Alrighty, hi everyone. Thanks for joining this presentation. So we're going to get started. So this is the Joint Commission training. So this is the clinical quality team. We have Lisa, Bree, Sarah, and myself, Vivian, and we are all based out in Minnesota. Then we have Dwynette, who oversees the Texas region, and then we have Miss Margaret, who oversees the Covington, Kentucky region. And then specifically, we have the accreditation gals, who are like a small section of the clinical quality teams. That is myself, Dwynette, and Margaret. You guys are able to reach any of us by either the Teams chat or via email, but we do have an accreditation email actually. So our organization is accredited by the Joint Commission. Hopefully everybody knows what the Joint Commission is. It used to be called JCO, but they are officially the Joint Commission, and they accredit numerous healthcare organizations and programs across the United States, and in different specialties as well too, from nursing homes to hospitals to home care and DME, and to hospice as well too. And it is recognized nationwide as a symbol of quality. So there's the fancy gold medal that each organization gets once they are accredited. And so an accreditation survey, similar to probably other accrediting bodies, there's an unannounced survey, so we only get a 30-minute warning the day of. And for Joint Commission, they do an unannounced survey every 3 years. So our last survey was in 2018. So we are actually due for an upcoming survey. And just last week, we actually added each site to our current Joint Commission application. And so at any given point in time, all the other sites could be due for potential survey as well too. And so that's why we're doing things like this meeting, doing the Jeopardy game. Hopefully you guys got my new the team trivia email, which I'll talk more about a little bit later. And just introducing all these policies, bombarding every department meeting out there, just to ensure that everybody is compliant and ready for a possible Joint Commission survey. Because our goal is for all the sites to be accredited because we are all one PHS. So when a survey does occur, a company-wide email will be sent to everyone so that everybody is aware that Joint Commission is here. And so survey activities just depend on the service lines and patient census. And also just something to note is that the surveyors are authorized to view patient records. Typically when they are viewing the patient records, either myself, Dwynette, or Margaret will be right at their side. We won't leave their side, so you at least have somebody on the inside to help navigate the EHR. And for further reference, we did make a kind of like a work instruction on how to respond to an unannounced survey. It's more so applicable to like the receptionist or the front desk people who are kind of the key individuals to ensure that the surveyors are comfortable, sign in, get a badge, things like that. So that is on MFiles, and that is the ID number as well. So some of the things that the clinical quality team does to ensure that we are quote unquote survey ready. We conduct field tracers. Right now that's kind of on hold due to COVID, but other sites are still permitting field tracers. So we observe the clinician out in the home just doing their thing, whether it's like vent checks or, going over meds, things like that. We observe them and then go over possible findings or just ways to improve. And then we also do system tracers where it's kind of the same thing, except we're more so in the office and we are observing their typical workflow. And then we also do record of care tracers, which is essentially a chart audit where we look at patient charts to make sure documentation is up to date and compliant as well too. And we do a bunch of numerous audits throughout the year to monitor compliance. And then we also introduce new policies, which is what we've been doing for the past few weeks. So your roles and responsibilities when a survey is underway is just to continue your everyday work process, making sure that you have your PHS badge on at all times. And when a surveyor comes to your department, it's important to follow whatever instructions that they give and also to respond to the questions appropriately. It's okay to say you don't know, but don't just say you don't know, but say like, I don't know the answer, but I can utilize my resources and get back to you or give you the right answer. And so we just really want to emphasize utilizing your resources, such as your managers, coworkers, us, the clinical quality team, and especially M-Files, because M-File stores all of the policies, all the work instructions, everything that you would need, it's most likely going to be in M-Files. So making sure that you guys do have access, and if you guys don't, please let us know, and that you guys are comfortable accessing M-Files and pulling up policies, things like that. And even like the employee handbook is in M-Files. So let's play Jeopardy! And before that, I just want to introduce the new the team trivia um, program that we are doing. I did send everybody an email yesterday, kind of summarizing what our incentive and program is with that. So hopefully you guys got a chance to review that. But starting this upcoming Monday, the clinical quality team will be sending everybody questions as it relates to different policies on M-Files. And it's not a hard test. You guys can utilize every resource out there. We encourage you to actually go to M-Files and look up the answer. And each day will be a new trivia question. And you email your correct responses for a chance to win some great prizes. So we will be drawing a $25 gift card at the end of each week, and this will run for approximately 6 weeks. And at the end, there'll be a grand prize drawing of a $250 gift card. So super exciting, lots of fun things coming up as we prepare for a potential survey, or just, to always stay compliant. So beyond that, so then next we will play Jeopardy! Alrighty.
So here are the directions for the game. Each person will be playing as an individual. When you know the answer, type the word buzz in the chat. So similar to how you watch Jeopardy and they hit buzz, instead of hitting, you're going to type it in the chat. The scorekeeper will announce the name of the individual who typed buzz the quickest, and that person will be given a chance to answer the question. So if the person answers wrong, the next person who typed buzz will be given a chance to answer the question. Whoever answers the question right gets to pick the next category in the game. Question? Okay. Who wants to go first?
Why don't we start with stop the spread for 100?
Okay. So this should be done when bringing a clinician bag into the home.
If you know the answer, type buzz in the chat, please. And we got Kyra. Kyra, if you want to unmute yourself and tell us your answer.
They need to put a barrier between their bag and the floor wherever they're setting it down. They have to make sure it's a clean surface.
That is correct.
Yay.
Yeah, that was cool.
100 points for Kyra, and you get to pick the next question.
Are you ready for a survey for 100 points?
Who should be contacted after a patient fall?
And this question's open to anybody, so you can type buzz in the chat. Tammy?
Management? Would that be management, your supervisor?
So that's another tricky answer. Yes, but it's not exactly the one we were looking for.
Darn.
Somebody else?
Anyone else has the answer, you can type buzz. Tammy, go ahead and try again.
Would that be the physician?
Yes, that's correct, Tammy.
Yay.
Alrighty.
Way
You're
to
up.
go, Tammy.
Tammy, go ahead and pick the next question.
Get with the program for 100 points.
Okay. Alrighty. Equipment and/or reusable items that have been in contact with a patient or in a patient home must be sealed in this type of bag.
Tammy again.
What is a red bag? It's a red, what would be a red, God, what word am I looking for? I don't want to say hazardous materials, but it's a red bag.
Oh, no, I'm sorry. That's
Okay, and Ingrid.
I was gonna say the same thing. Never mind.
Anybody
Here's a
else?
hint. All that's wrong is the color. So if you buzz in and guess a color, you might get it right.
Would it be a yellow bag?
no, sorry.
Oops.
All right, Kyra.
Is it a black bag? What would be a
No,
black
sorry.
bag?
No, ma'am. Sorry.
Well, a black bag would be acceptable. So, Kyra, I think the black bag would be acceptable, but if you want to talk through that a little bit more, Vivian, kind of what the policy says with it.
Yeah, so it's actually a white opaque plastic bag, and this is something that we are kind of hammering out with the biomed department here, and also the different sites and the equipment cleaning processing people as well, to kind of make like one streamlined process. So we kind of came up with like a colored bag scheme for everybody to follow, and we're actually making kind of a poster, so watch out for that soon. But so for used or dirty equipment, it would be a white opaque plastic bag, just to make it consistent and not confusing. So it's just going to be white, and once it is cleaned, like in the cleaning room and all that stuff, it would be in a clear plastic bag. And so that's like the main differentiation for those two.
Okay, Vivian, when is this starting? Because our bags are red.
I am going to talk with Derek, because yeah, I'll talk with Derek.
Thank you.
Yep, you're welcome. Okay.
So Kyra, if you can pick the next question.
Let's just do, are you ready for a survey for 400 points?
Okay. How many days within initiating services, ooh, this is double jeopardy. How many days within initiating services should a patient receive an initial assessment?
So this one's worth 800. Anybody?
Clinicians out there? Okay, who we have here? Wait a second.
I think Rachel was
Yeah,
the
it's
first
Rachel.
one.
I didn't see the name. Sorry, Rachel. Rachel, what's your answer?
3 days. I want to say it's either 48 or 72 hours, because we had this question before and there was confusion. Someone said 3 to 5, but I want to say it's within 3 days.
No, that's incorrect.
And I think, hi guys, this is Cameo. I think Raquel looks like she's doing a beautiful job at multitasking on the phone with Blue Cross Blue Shield, but also has chatted in a couple answers.
So it looks like she's after Cynthia. So Cynthia, if you can give us the right answer. Cynthia, are you there? Okay, and yep, Raquel had the answer of 5 in her chat.
That's correct. Within 5 days.
So 800 points to Raquel.
Okay.
Raquel, are you able to give us a next question? She says, pick for me. I'm going to say, be on the lookout for 300.
This should be reviewed at initial setup and continuously with the patient and caregiver concerning potential emergencies.
It should be reviewed at initial setup and
Tammy, what was your answer?
Home environment assessment?
No, ma'am. Sorry.
Boy, I am tanking. Like it.
But really good answers, Tammy, because that should also be reviewed.
Okay, Raquel is again. Raquel said POC?
Plan of care?
Oh, no, that's incorrect.
Okay, Jan is next one.
I'd say emergency preparedness plan.
So that's really close. There's something within that. Emergency preparedness plan.
Right.
I
Yeah.
just say I think that's close.
That's close, yes.
Yeah, we'll give it.
Emergency action plan.
Yay!
Give it to
Good
me.
job. Way to go.
And this can be accessed on M-Files, and then you can download it. This would be, for clinicians, and you can download it and kind of modify it regarding who your patient is, what type of equipment they have, things like that. But it is accessed on M-Files, as with all these policies and work instructions. Okay.
Jan, you get to pick a question.
Oh, sorry. Let's try be on the lookout for 100.
Where are all company policies located?
All right, Jose. Jose, do you have an answer?
You
Oh, yeah,
chatted
sorry.
M-Files.
I was talking to myself. I was like, okay, nobody can hear. The M-Files.
Yes, that is correct. M-Files.
Now you get to pick a question.
Okay, stop the spread for 500.
When possible, when should patients with multi-drug resistant infections be scheduled? I can repeat that. So when possible, when should patients with multi-drug resistant infections be scheduled?
And Raquel, she got it. She said last day.
Is
that correct?
Yes.
Yes.
End of the day, yes.
Okay.
Yay.
Yay.
Alrighty, so maybe Bree, you'll have to pick for her. Yeah.
Let's do get with the program for 300.
Okay. Where should equipment, another double jeopardy. Where should equipment processing staff look to see how long alcohol or bleach-based disinfectant should sit on equipment after spraying?
Tammy?
MSDS files?
Yeah.
The MSDS for the product?
Yes, that's correct. The manufacturer's guidelines, which are the SDS. Yay, Tammy.
I got it. Yay.
Yay.
Alrighty.
All right. Pick a question, Tammy.
Get with the program, 400.
These must be worn at all times when cleaning equipment or reusable items.
Tammy?
What are gloves?
That is correct. Non-permeable gloves. Great job, Tammy.
Okay.
I can give a quick rundown on our score. We got Raquel in the lead with 1,300. Tammy's close behind with now 1,100. And then we have Janie with 300, Kyra with 200, and Joe with 100.
Okay, the next one would be stop the spread for 400.
Okay. Clinicians' vehicles should have these 2 items for safety.
Jose?
We should have their PPE gear and fire extinguisher, first aid.
That's correct. PPE kit and first aid kit. Yay.
Let's do, be on the lookout for 400.
This should be done with the parents or caregivers if a tripping hazard is noted in the patient's care area.
Okay, Raquel again? Can she type the answer?
Yeah.
Raquel, do you have the answer? Raquel has on there, call the physician.
Not quite, Raquel.
Tammy, it looks like you were up next.
I would say remove the tripping hazard and make sure it's documented in the clinical notes.
Not quite. This is something specifically done with the parents or caregivers.
Okay.
Okay, Jose?
I was going to say exactly the same thing.
Okay, Jan? Jan, are you there?
Yes, but I didn't buzz.
Oh, I said it looks like you did. I'm sorry.
No, I was just telling you it should be listed as Jan, not Janie, for the 300 points. Sorry.
All right. All right.
So a hint, this involves talking. Okay, we got Raquel.
Raquel has on, she chatted in, remove the hazard.
No, not quite.
And then I think Cynthia has also buzzed in.
Yep, removing the hazard is part of it, but there's another key critical area that goes along with this, or another key step.
Cynthia, do you have the answer?
Yeah, I put on initial setup.
What?
But yeah, I don't think I got it.
Okay, we'll move on to Rachel. Last one.
Remove the hazard and train the parents on why that's a hazard and how it should be avoided.
Ding, ding, ding. Educate. Educate.
The key thing is like the interventions on top of removing the hazard, making sure that we're educating the parent or caregiver so that they don't do it again the next time you go. Okay.
Okay.
Be on the lookout for 200.
This scenario requires the clinician to either complete a Caesar and a post-falls assessment in the EHR.
Rachel?
What they have to do when the patient falls in the home or while they're there. They need to complete one of these afterwards.
That's correct. When a patient falls that isn't related to age or diagnosis. Great job.
Get with the program 500.
For all cleaning solutions and procedures, you should follow these specific guidelines.
Rachel?
The manufacturers.
That is correct. Yay.
Be on the lookout for 500.
This type of event reaches the patient and results in death, permanent death, or severe harm.
Vicky? Was that?
Yes, I'm going to say adverse effect.
I think we'll take that. The answer is sentinel or adverse event. Good job.
Okay, now Vicky, you can.
Oh, let's go. Are you ready? Are you ready for a survey for 500?
A care plan or plan of care should be developed within how many days of equipment setup and or initiation of therapy?
Cynthia?
3 days?
Almost, but not quite.
5?
All right. Vicky?
I'm going to say 2.
That is correct, Vicky.
Yay!
Yay. It's awesome.
Okay.
Vicky, you get to pick the category.
Sorry. Let's go. Are you ready for a survey for 300?
This is done within 5 days of discharge to promote a safe home environment.
Jan? I'm going to guess here and say a home assessment.
That is correct. Home environment assessment. Very good. You get to pick the category.
All righty, we're going to finish out the category. Are you ready for a survey for 200?
When a Joint Commission surveyor asks a question, what is the main thing you should not say and what is something that you should say?
Jan, you should never say, I do not know, or I don't know. And if you don't know, tell them that you can get with your resources and find the answer and let them know.
Yeah, that is correct. Very correct.
Okay, okay. How about get with the program for 200?
Equipment or reusable items from an infested home must be bagged and sealed in this type of bag.
Jose?
Blue bag?
That is correct. A blue opaque plastic bag. Great job. Yes.
Stop the spread for 300.
What needs to be at least 60% alcohol to be effective?
Vicky? Vicky?
Sorry, hand sanitizer.
That is correct.
Yay.
Okay, last one. Oh. Okay, aside from hand hygiene, these are two other ways PHS clinicians use routinely to prevent infection. Hence, there are more than two, but you can just list two if you want.
Tammy?
You're on mute, Tammy.
Sorry, what are gloves and or mask PPE?
Yes, so PPE, hand hygiene, sharp safety, cleaning and disinfecting equipment, barriers between bag and floor. Awesome.
Yay! Do we have a winner?
We actually have a three-way tie. So,
Ooh.
Vicky, do you have any extra questions you can pull out that?
Oh gosh, yes. Hold on.
We have Tammy, Raquel, and Vicky all tied with.
Oh wow.
1,300 points.
Woohoo.
Oh, let me think of something right at the top of my head. Oh, what instances would so what scenarios would result in a clinician updating the plan of care?
Tammy?
Or when would someone update the plan of care?
A change of order, a change of medication, a change, any kind of change.
Yeah. Yeah, I think the key word is change, or just making sure that the plan of care is updated and reflecting the current therapy that that the provider ordered. So that's the key thing, is when there's a change. So good job.
All right.
Woohoo!
Good job,
Yeah.
Tammy.
Yay.
Tammy's the winner. Yay.
Yay.
Way to go, Tammy.
Good job.
And so thank you guys so much for being a part of this. This helps us because it's, an assessment tool for our team to identify, where the gaps are, which areas you guys are pretty confident in, and which areas that we can do a better job at informing you guys on the different policies, because I know it's a lot of different policies and a lot of information that we're throwing at you guys. So this serves as an evaluation tool. So thank you guys so much for just your willingness to participate and giving the feedback and whatnot. But yeah, starting on Monday, look out for our daily questions. It'll be a lot of fun. Everybody loves prizes. And like I said, it's another great way just to get comfortable with Joint Commission surveyors, because they may ask like a lot of these types of questions. So making sure that we know where our resources are, and that, we're, if we're unsure of the answer, making sure that we voice that instead of making, an answer up. We don't want to do that. So with that, if you guys don't have any other questions, I'll let you guys go. Or if anybody else from the clinical quality team wanted to say a few words.
I just want to say, if you do have, this is Gwinnett Thomas, if you do have any questions, we're always open to answer them. Please email us, chat us. We are more than happy to address your concerns and get you the help that you need, the tools you need to do your job effectively. So thank you.
I'd like to second that. Thank you all for taking the time to do that. And again, just, continue to get more comfortable with all those policies and procedures. And if you do have any questions, we've got a lot of people that if you don't know the answer, we'll get the answer for you guys. So we'll just continue to learn from each other. So thank you.
Thanks, guys.
Thank you.
Thank you.
And
That was fun.
obviously, Tammy knows the answer to a lot of questions, so she can answer a ton of those questions. Nice job, everybody.
Thank you.
Thank you.
All right.
Thank you.
Thank you, bye.